Planned Parenthood faces funding crisis. Impact on health services. Imagine waking up to find half your healthcare budget slashed overnight. Not because of bankruptcy or mismanagement, but because of a political decision that labels your life-saving work as controversial. That's the reality now facing Planned Parenthood of Orange and San Bernardino counties, which serves 130,000 patients annually. A new federal budget bill, backed by the Trump administration, has ignited a firestorm by cutting Medicaid reimbursements to the organization. A move critics call a backdoor assault on reproductive health care. But here's where it gets complicated. While the Hyde Amendment has long banned Medicaid funds for abortions, this new rule denies payments even for non-abortion services like cancer screenings, STD testing, and birth control. And this is the part most people miss. Losing Medicaid reimbursements doesn't just hurt Planned Parenthood. It threatens access for low-income families who rely on these clinics as their primary healthcare source. /N Krista Hollinger, CEO of the local affiliate, isn't holding back. She calls the bill an outright defunding tactic disguised as fiscal policy, arguing it's less about balancing budgets and more about restricting abortion access. If we lose 50% of our revenue, how do we stay open? She asks, a question that hits hard when you consider their patient load. Many are low-income individuals who'd struggle to find alternative care. But here's the controversy. Opponents of the bill argue that accepting Medicaid dollars while offering abortions creates a conflict of interest, even though federal law already separates abortion funding from other services. Supporters, however, see this as a dangerous precedent that punishes clinics for providing constitutionally protected care. /N/, and let's break down the stakes. Medicaid reimburses providers for services like Pap smears and contraception, which Planned Parenthood offers to thousands who can't afford private health care. Under the new rule, these reimbursements stop entirely because the clinic also provides abortions, a service that, ironically, doesn't use Medicaid funds in the first place. Critics call this cutting off your nose to spite your face, harming vulnerable communities over ideological lines. Yet the debate isn't black and white. Some argue that taxpayer dollars shouldn't support any organization linked to abortion, even indirectly. Where do you stand? Is denying reimbursements for life-saving care a legitimate policy choice, or a punitive measure hiding behind budget politics? /N Planned Parenthood vows to fight back, exploring budget fixes and rallying supporters to donate. But the clock is ticking. Without Medicaid, clinics may have to reduce staff, close locations, or limit services. And this raises a chilling question. When healthcare becomes collateral in political battles, who really pays the price? The organization's final message? We're not backing down, but this fight needs all hands on deck. So tell us, should healthcare providers be penalized for offering legal medical services? Or does this mark a necessary line in taxpayer spending? Share your thoughts. We guarantee this comment section will spark more than a few heated debates.